Hometown Radio, KGAF presents the Community Service Report. Here is Dee Blanton.
Well, hello again. Welcome to our Community Service Report on this Thursday. Today, Muenster Memorial Hospital Day, and very happy, as usual, to be joined by Brian Roland, the CEO at MMH. How you doing?
I'm doing great, Dee, and I'm excited to be here. Happy New Year, everyone.
Happy New Year to you. It's great to have you here to start a brand new year. And that being said, there's a lot to look forward to, I think, when it comes to MMH and healthcare in general.
There is a lot of stuff going on. You know, it's really an exciting time of year with the legislative folks down in Austin kicking everything off. Right now we're already over 1,018 bills that have been listed. 65 plus have healthcare related things. And it's going to be an interesting 4 months as they go through all of the different pieces and figure out what's going to work, what's not going to work, what they're going to fight over, what they're not going to fight over, and are we going to build a wall?
Yeah.
And healthcare is one of those things where when you look at this stuff, I think a lot of times where the legislative stuff comes out where everybody can see the pieces that they understand, I think there's a lot of things that go on in healthcare that people don't see or don't understand. And those are some of the things I'd kind of like to talk about this morning. As we talk about all the time, we've got to manage today as we prepare for tomorrow. That becomes even more of a challenging, interesting scenario. I kind of look at healthcare sometimes as an iceberg. I like to use that analogy because a lot of times people only see what they see above the water, but there's a lot of stuff that goes on below the water. Even in Muenster, we have to work our hospital and run our hospital the same as a Baylor Scott & White, who has multiple facilities, thousands and thousands of beds. And I think there are challenges out there that people don't see. And those are some of the things I want to share as we kick off 2019, because it's really interesting information. The American Hospital Association and the Texas Hospital Association, where I've got some of this information I want to share, is putting out some information about healthcare workers, your doctors, interesting information as we move forward in our lives and what healthcare can do for us. So there's some interesting numbers here I want to share with you because, as we look at it, and a lot of us can relate to this, 30 years ago, changes in healthcare went at a snail's pace or a turtle's pace. Now things change at that rabbit pace. Over and over, day to day, everything is changing. The government's expecting us to do more, report more, and then they're going to cut our reimbursement 2% and not pay for this. I had an interesting conversation with somebody. Sometimes I feel like healthcare is like, I would like our restaurant to be like healthcare. I bring a patient in, we treat them, and then the insurance company decides, are they going to pay us or not? Wouldn't you like to go to your favorite restaurant and say, hey, I'm going to sit down and eat, and based on how you treat me then I'm going to decide if I pay you or not. Mm-hmm. That's not an option. Or, you know what, I'm going to fill my car up with gas, and depending on how that tank runs, that's how I'm going to pay you. We don't have that luxury, but healthcare forces that, whether it be the Medicare Advantage plans, the replacement plans, or the insurance companies. I treat you, I take care of you, we do all the work, we get you better, we get you home, and then the insurance comes back and goes, you know what? I think we'll pass. Yeah. And they can do that, and it makes our lives really, really challenging sometimes because our number one goal is quality. And there's some interesting stats that I want to share because, in 1970, 10% of the adults were over 65. Right now, they're telling us that in 2030, 20% of the adults will be over 65. In 2018, an average of 10,200 people turned 65 every day. Every day, we had more than 10,000 people turn that age. And then you take that data and you look at 1 in 25 people have used genetic analysis testing. So all those ads for Ancestry DNA and all that stuff, I've done them. I've done them. Excuse me. I have to say that I have tried these. But But my concern is some people use these as self-diagnosing tools, which makes it a little more challenging. I just wanted to know where I was from.
Yeah. Right.
And so you have all of this stuff happening, but then on the other side of the numbers, you look at it and it's showing us that, and I'm looking 12 years out, because if we're managing, I'm looking at 2030. They're basically telling us or thinking that we're going to have a total physician shortfall of upwards of 121,000 physicians, and of that, 49,000 could be primary care doctors. Mm. And then you look at that, and then you also look at now they're tracking physician burnout, which years ago we didn't, because there was no such thing. 42% of the physicians say they have burnout. 14% say they have burnout and depression. And then you take those numbers and you look at the fact that we have 3 million nurses now, and by 2022 we're going to need another million. Mm-hmm. And if you go back and look at the numbers, since 2012, the average hospital has turned over 80% of their nursing staff. Now, you're looking at those numbers going, okay, this is algebra, and I didn't care for this when I was in school, but it really makes the challenge more challenging, and this is the stuff that's under the water that people don't see. And those are the things that, while we're creating the environment that we want our employees to like where they're working, and we want to work with our physicians, and quality is number one, there are all these other things that we have to deal with. And this then wraps back around when the legislative folks in Austin are trying to figure out why Medicaid is going to underpay us by $65 million. And, we're going to cut here and cut there. And even Medicare Advantage plans, well, they're great. I love the one that my mother was on. But in a critical access hospital, they're actually a bad thing, because I can't count those days and I don't get reimbursed the same way. Mm-hmm. I don't get the cost. And so, while they're good, people don't really understand the challenges that we have. So with all that being said, that iceberg, everybody sees the top, what's outside the water. And I love, and people know that they can contact me anytime. I love talking about what's under the water, because what I can talk about, you throw in EMTALA, you throw in HIPAA, you throw in the privacy stuff, you throw in computers, you throw in all that other stuff. Healthcare is changing at that rabbit pace. And realistically, is that ever going to change now? Think about it. 30, 40 years ago, we still had all of these ailments that we have today. Mm-hmm. It's just nobody knew about them.
Right.
And now we're dealing with them. And how do we deal with that as we go forward? So that's kind of my I guess we'll call it my iceberg soapbox. We do have a lot of other stuff going on at the hospital. Things are going really well. Our numbers look good. We do have, and I had to make sure that I got this out, we are having a community shred event at the hospital on the 18th from 12 to 3. If you have, if you're cleaning out your closets and stuff and you got a bunch of papers you want to get rid of, we're going to have a truck up at the hospital that will actually shred all your paperwork. We like to do that for the community. Our own employees are going to use it. Now, we do have a limit of 5 bags or 5 boxes because the truck's only so big. Mm-hmm. But as we continue to move forward, that managing today as we prepare for tomorrow, and we've talked about this for the last couple of years, that really is coming into, and it's not where we used to strategic plan for 3 years. Now we're looking at 10 years, 12 years, 15 years down the road. Mm-hmm. So, and
as in education, so is healthcare. It's really hard to do. It's really hard to plan because you don't know what to expect.
Well, and that's the thing. Theodore Roosevelt said you got to watch the risks, because risks can either make you or break you. Mm-hmm. But sometimes you got to take that risk because you don't know what's out there. And if you don't take that risk, you're not going to be prepared for tomorrow.
Yeah, that is so true. All right, we are out of time. Brian, as always, a pleasure, and look forward to seeing you again next month.
Sounds good.
All right, very good. There he goes. It's Brian Roland, the CEO at Muenster Memorial Hospital. And that's going to wrap it up for our community service program here on this Thursday morning at Hometown Radio, KGAF.